Good afternoon. I'll begin, as usual, with the daily report on COVID statistics. The total number of positive cases reported yesterday was 1,202. That represents 6.8% of all tests that were carried out yesterday. 451 of yesterday's new cases were in Greater Glasgow and Clyde, 292 in Lanarkshire, 152 in Lothian and 91 in Ayrshire and Arran. The remaining cases were spread across 9 other health board areas. The Western Isles was the only health board area yesterday not to record a new case. That takes the total number of confirmed cases in Scotland now to 60,403. I can also confirm that 1,117 people are in hospital. That's an increase of 17 from yesterday. 85 people are in intensive care. That's 3 more than yesterday. And I very much regret to say that in the past 24 hours, a further 28 deaths were registered of patients who first tested positive over the previous 28 days. And that takes the total number of deaths under this measurement to 2,754. National Records of Scotland, though, has also just published its weekly update, which you know includes cases where COVID is a suspected or a contributory cause of death. And today's update shows that by last Sunday, the total number of registered deaths linked to COVID under that wider definition was 4,482. 106 of these deaths were registered last week. That is 31 more than in the week before. Of last week's deaths, 82 occurred in hospitals, 18 occurred in care homes, and 6 were at home or in another non-institutional setting. We can never obviously see these deaths simply as statistics, and I think it's important, I know for me and I'm sure for all of us, to remember that every single one represents the loss of a unique and an irreplaceable human being. So once again, I want to send my deepest condolences to everyone who has been bereaved during the course of the pandemic, including and perhaps especially at this moment, those who have lost a loved one in more recent times. Now, I have a couple of specific points I want to update on today. They relate firstly to care homes and secondly to the Protect Scotland app. Before I do that, though, let me just acknowledge that the Scottish Government's new strategic approach to tackling COVID was considered yesterday by the Scottish Parliament, and Parliament last night voted unanimously for the motion submitted by the Scottish Government. Tomorrow we will formally confirm which areas of Scotland will be in which level of the framework from the 2nd of November, and work to finalise these decisions will take place over the course of today and this evening, where I will receive advice from the Government's clinical advisers and the Cabinet will reach a conclusion. That will also take account of ongoing consultation with local authorities. We will also publish tomorrow more detailed tables on what the different levels mean for children and for people who were shielding over the spring and summer. Before then, though, let me take the opportunity to say thank you to the other political parties for the very constructive suggestions they have made about the framework, and indeed to all organisations who have talked to the Scottish Government in recent days. We will continue to work closely with partners as the framework is implemented, and we will continue to improve and refine it whenever we can, and particularly as our knowledge and understanding and experience of the virus continues to evolve. But it's probably also an opportune moment just to say this and to recognise again that the position we are in right now is really tough and everyone is thoroughly sick of it. And that's been the case for some time, but as the nights get darker as we head into winter, and of course as our attention and thoughts turn to Christmas, I think that feeling becomes a heavier one for all of us. Unfortunately though, however much we might like to, we can't magic COVID away. There is simply no alternative to all of us working together to stop it overwhelming us, to stop it overwhelming our National Health Service, and to stop it taking lives if we possibly can. And the other thing I think it's worth remembering, not because it makes us feel all that much better, but to give us all a bit of perspective, is that we are not alone in this. Scotland is not uniquely living through COVID. In fact, many of our European neighbours right now are struggling with situations even more severe, in some cases significantly more severe than the one we are currently facing. Now, as I say, that doesn't make what we are going through any easier, but it is a reminder that this is a global pandemic. It just happens that our generation is unfortunately the one having to live through it. We will get through it. I think that is the one thing we can be reasonably certain of, but the journey through it is and will continue to be really difficult for people. And I think it's important for me to acknowledge that and to acknowledge the very difficult sacrifices people are making, and to take the opportunity again to thank all of you for that. Let me turn now to my two specific updates. The first relates to a report commissioned by the Scottish Government, which has just been released by Public Health Scotland. The report looks in some detail at discharges from hospitals into care homes during the early months of the pandemic, and the extent to which people were tested before discharge into care homes. And it examines whether these discharges were associated with outbreaks of COVID in care homes. Now, the report's authors, together with the Chief Nursing Officer, are hosting a detailed briefing for journalists later this afternoon. I won't go into all of the details of the report this morning, but I think it is worth highlighting that because the report uses some fairly detailed statistical modelling, it's not always a straightforward read. The other point I want to make before saying a little bit about the conclusion of the report is that nothing in it detracts from the tragedy of the deaths that have occurred in care homes over the course of the pandemic, and nothing ever will detract from the heartbreak of those bereaved. And it doesn't take away either from the duty of government, which is one we rightly feel acutely, to learn and apply lessons. All of that said, though, the report does have some clear findings and recommendations, and you can access it yourself on Public Health Scotland's website. It concludes that once we allow for other factors, such as the size of a care home, hospital discharges were not found to have contributed to a significantly higher risk of an outbreak. And it's probably worth me quoting direct from the report rather than seeking to paraphrase it. The report says, and I'm quoting at this stage, "The analysis does not find statistical evidence that hospital discharges of any kind were associated with care home outbreaks." And what they mean by "of any kind" is discharges where a person tested negative before discharge to a care home, or tested positive, or were not tested at all. It is important, though, for me to point out that the level of certainty about that conclusion differs in each of these three scenarios. But the overall conclusion is, as I have stated, that there is no statistical evidence that hospital discharges of any kind were associated with care home outbreaks. I understand this is similar to the findings observed by Public Health Wales when it also looked at this issue. Now, as I said a moment ago, this report is important, and it's important for accountability. It's also important for learning, but it is of no comfort, and it never would be of any comfort to those who lost a loved one. So we will be supporting Public Health Scotland to take forward further work and analysis so that we have as detailed an understanding as possible of the outbreaks that did take place in care homes. And of course, we will continue our work of the last few months to further improve safety measures in care homes. For example, as you know, we now do routine weekly testing of care home staff, and we plan now to extend that testing to designated visitors to care home and to a wider range of professionals who enter care homes regularly. We're also considering the findings of the report so that we can better mitigate against the potential effect of care home size in seeking to prevent COVID infections, and the Health Secretary will set out more on that in a statement to Parliament next week on social care planning for the winter period. And where the report's conclusions highlight the need for additional measures, we will act on that. So I want people to know that we take this very seriously. And lastly, on this subject, I think it is appropriate for me to again convey my condolences to everyone who has lost a loved one to this virus, but in particular to those who have lost loved ones who were resident in care homes. Now, the second point I want to cover is, of course, related because it is to do with COVID, but it is a very different issue. And that is to highlight today a further improvement to the Protect Scotland app. Since it was launched, the app has been downloaded by more than 1.5 million people across Scotland, And I can tell you that it has already notified more than 10,000 contacts of positive cases with advice to them to self-isolate. And that's important because in some cases, of course, these people would not otherwise have been notified because they will have been people that the positive case might not have known that they'd been in close contact with. And of course, in most cases, the notification would have been quicker than through traditional manual contact tracing because it was done automatically through the app. So the improvement that has now been made to the app is about interoperability. And it means that as of now, the app works in both Northern Ireland and Jersey. So if you have to travel to either of those two locations on essential business, you can keep using the Protect Scotland app. You don't have to shift to the app in these places, and you will be notified if you're in close contact with someone who gets COVID and enters that fact onto their app. And that's a mutual thing. So the Northern Ireland app will work here just as ours will work there. Now, this enhancement is the result of extensive work that NHS Scotland has done to develop a server that allows different apps to work together. And it will also be able to handle information from other apps in due course. For example, the English and Welsh app is due to be updated in the next few days, but we've already reached an agreement that that app will be able to join the NHS Scotland server once the update has happened. So that means the Protect Scotland app should be able to function in England and Wales from early next month and vice versa. And we also expect that it will be able to function in Gibraltar if anybody is travelling there. Discussions are also underway about ensuring the app can operate in other countries across Europe. So this demonstrates the fact that we keep on improving the app to enhance its capabilities. But of course, ultimately, its usefulness is down to all of us. So there's two things I want to continue to urge people to do. Firstly, if you haven't already done so and you're able to, please download the app. As more than 1.5 million of us already know, it takes less than 2 minutes to do it. And as the numbers I've just reported demonstrate, it does make a difference. But secondly, once you have downloaded the app, if you test positive for COVID, please make sure that you enter the code that you will be given when you test positive. That sounds basic, but the evidence we have so far suggests not everybody remembers to do that part. Entering the code is essential in order for people that you've been in close contact with to be notified that you have COVID. So if everybody not just downloads the app, but remembers to do that crucial bit of entering the code, then the app will make an even bigger difference. Those are the two specific issues I wanted to update you on today. Let me close, as I usually do before the Chief Medical Officer and I take questions, by reminding you of the current rules and guidance. If you live in Lothian, Lanarkshire, Forth Valley, Ayrshire and Arran and Greater Glasgow and Clyde, please don't travel outside the area you live in unless you have a clear need to do so. And please don't travel to these areas from other parts of Scotland unless it is necessary. None of us anywhere in the country should be visiting each other's homes at the moment, except for very specific exemptions like childcare or if you're looking after an older person. And when we do meet people from other households outdoors or in public indoor places like cafes, the maximum group size should be 6 from a maximum of 2 households. In addition, please avoid car sharing unless it is essential. I've had people contacting me asking me if that is really important, so let me give you this piece of information. According to our most recent figures, more than 1,000 people who tested positive for COVID in the previous week reported sharing a car. Now, that doesn't mean that's where they all got the virus. We've gone through this before. People give this information to test and protect, but it is possible that some of these people got the virus from somebody they were sharing a car with. Work from home if you can, and as I've already covered, download the app if you haven't already done so. And finally, remember the 5 rules that will help keep us all safe. Wear face coverings, avoid places with crowds of people, clean hands and hard surfaces, keep 2 metres distance from people in other households, and self-isolate and get tested if you have symptoms. It's by following these rules that we can protect ourselves and protect those we love, but it's also by following these rules that we can support and protect our NHS. And I want to end by emphasising this point, and it's a point that we made frequently and regularly and people responded to magnificently at the outset of the pandemic. But as we see hospital and ICU admissions rise again, it is vital yet again to make sure that we do protect our NHS so that it can protect those who need treatment for COVID, but also those who need treatment for other illnesses and conditions as well. And of course, it's by following all these rules that we can also save lives. And that right now is the most important thing of all. So my thanks again to everybody for all your efforts in doing all of that. It is deeply appreciated. And if we all continue to pull together to do these things, then hopefully we will continue to see the progress we need to make in getting through this virus. Thanks very much. And I'll now move to questions. Peter McMahon from ITV Border is the first question.
Thank you, First Minister. First Minister, you said that there are talks going on with local authorities. I understand that will include Scottish Borders Council today about the levels you're going to announce tomorrow. If you look at your own statistics, new cases per week, for example, percentage of positive tests, the expected demand in a health board, and you look at those for Scottish Borders Council as has been published, they all suggest that for Scottish Borders Council, a level 1 would be appropriate because of those figures. Have they not got a case for being at that level when at the moment the recommendation is for level 2?
Local authorities will have views they want to feed in, and we listen to that. I think it's going to take all of us a little bit of time to understand how this process works and to understand the role, and it's an important role, that the hard statistics play in reaching decisions that also involve applying judgment to those statistics. And it's not an easy process. It's certainly taken me a while as a non-clinician, a non-expert to get an understanding of that. And I'll try and explain some of that just in a little bit more detail. Gregor will probably want to add. But the first point to make, which is relevant to this moment in time, and I said this in Parliament yesterday, as we first migrate onto this new system, we will apply a degree of caution at the outset, just to make sure that as we move to a new system, we're not taking risks that are greater than we should be. So there will be a little bit more caution applied at the moment as we get used to this new system and get used to making these judgments. But more substantively, the reason why it is important to look at the statistics that you set out, but it's important that we don't see that as leading inexorably and automatically to a given outcome, is that there are wider contextual issues that we have to take into account. And that's where the judgment that we have to apply to this comes in. For example, the statistics that you've just quoted me, absolutely rightly, and you've taken them from the Scottish Government paper, one of the judgments we've got to reach is that a sustainable position? Or is that just something we're seeing one week that next week we think may have gone in the wrong direction? So have we seen a sustainability to the low levels that the numbers are suggesting? Secondly, and this will be more relevant to certain other parts of the country than it necessarily is to the borders, what are the interdependencies and interactions between different parts of the country? So one area may have lower levels than neighbouring areas, so may well go to a lower level. But we've got to take into account that people, even with advice not to do that, if people are travelling in and out of those areas for work, for example, then they may be taking the virus in and out. Or if you have a situation which is at a lower level, so pubs are more open, do we then have people coming in and perhaps risking the low level? And thirdly, and this will be the final point I make before handing over to Gregor, one of the indicators, and you mentioned it, is looking at actual and projected hospital capacity. And that's also where no local authority is absolutely self-contained. So different local authorities, because obviously there are a number of local authorities within the same health board area. If you take Inverclyde, for example, an area in Greater Glasgow and Clyde that has, I think, lower prevalence than other parts of Greater Glasgow and Clyde right now, they rely on the same overall health network, so the same hospital beds, the same ICU beds. So in some cases, we might have to be more cautious because allowing a level to go, an area to go to a lower level and then risking an increase when the overall hospital capacity in that health board might already be strained, may not be the most sensible thing to do. So I'm probably contributing to everybody's initial confusion about how all of this works. What I'm trying to demonstrate is that the raw statistics are not unimportant, absolutely not unimportant, but we have to take account of wider contextual issues in coming to balanced judgments. And that is harder to explain than just the raw statistics, which is why we will set out the reasoning for these decisions. We will develop that as we go through, and hopefully over the next few weeks people will develop a greater understanding of exactly how these decisions are arrived at. And of course, in all of that, the views of local authorities are important because they know their local areas, they've got an understanding of travel patterns that we might not always have. So that's why the process of consultation is such a vital one.
The first thing I want to say is that the range of data that's available to us now to help to guide us with these decisions is greater than we've ever had before. And I want to, at this point, just pay tribute again to our colleagues from the analytics professions who continually serve this data to us. I think it's really important, though, that we don't get drawn into an overly mechanistic process when we take these decisions, and that need for judgment that the First Minister has described there is incredibly important so that we understand, first of all the nuances of the data, but also take into account all the other aspects of local intelligence that feed in to that decision making too. When we speak to the public health community, and particularly the members of the National IMT in relation to the data that they are working with just now, one of the consistent features that we get when in those discussions is the need to make sure that we have stable data and that we are consolidating a safe position before we begin to make changes. That's important because in strict public health terms, what we have traditionally done is, as we've been observing a response to an outbreak, we traditionally use incubation cycles to see exactly how that response is beginning to stabilise over time. Now, traditionally, that has been anything up to 2 incubation cycles before we start to make those decisions. And in this case, in COVID, we've tended to use a period of stability before we begin to make any changes, so that we can be sure of ourselves that actually the figures that we're seeing are, first of all, reliable and stable, and that they reflect the real position within the community, but also that we don't start to get simply an oscillation of those cases where we could have a situation where local authorities oscillate between levels on too regular a basis. And I think that that would not be beneficial to anyone if that was the case. So this is about ensuring that we have a very stable, consolidated picture and that it's safe to be able to begin to make those decisions to change the restrictions that are in place.
None of us have got any interest in keeping any part of Scotland with a higher severity of restriction than is necessary, but all of us have an interest, and I think it's shared across the country, of keeping Scotland as safe as possible. And if that occasionally means, as we will do, as we have throughout, erring on the side of caution, then that is about saving lives and trying to stop people becoming sick. So these are all factors that will be taken account of in the judgments we arrive at. Laura Alderman from STV.
Good afternoon, everyone. First Minister, I just want to go back to that delayed report that's out today from Public Health Scotland on the discharges from NHS hospitals into care homes. And as you said, that report found that thousands of these discharges were not statistically significant if a care home is large or if they have certain characteristics. So essentially, is the Scottish Government washing their hands of this problem and blaming staff for the crisis in our care homes? And do you still maintain that you didn't know about this practice at all until that newspaper investigation exposed it?
Laura, thankfully people watch and listen to what I said about this, and nobody, I hope, could have reached the conclusion that what I said equated to washing my hands of it. I actually find that, just well, look, I'll let it go, but that is not the case. I take this extremely seriously. How I feel about this, and I'm going to talk a little bit emotively here before I return to your very legitimate questions. How I feel about it is nothing compared to people who have loved ones in care homes, and particularly those who lost loved ones in care homes. But I've said this before, and I'll say it again because it is true. For as long as I live, the agonising over decisions we've taken in this pandemic generally, but particularly those that affected people in care homes will live with me. And that's right and proper, because this is a a significant responsibility. But the idea that I wash my hands of any of this is just could not be further from the truth. We take this very seriously. This is a report, you described it as a delayed report. It's been a complex report bringing together lots of different data sets, and Public Health Scotland have done it in their way, on their timescale, and have discussed the timing of it, as I understand, with the Statistics Authority, who were satisfied with what they were doing. But it's been done independently. The authors of this report, it's a report by Public Health Scotland and renowned expert academics, so it is entirely independent of government. And it reaches that conclusion that there is no statistical evidence that discharges, when you take account of all of the factors at play, no statistical evidence that discharges from hospitals to care homes increased the risk of outbreaks. And that's the independent conclusion. That doesn't mean there weren't outbreaks. And it's the outbreaks that we take seriously. And people died in those outbreaks. So we have to continue to understand them better. We have to continue to understand the factors that drive them. Just because we have a finding here that one particular factor didn't particularly drive them, it doesn't mean we don't have work to do to better understand what did, and to make sure we're taking all of the right protective action. We've already done some of that in the changed approach to testing. There is a wealth of work done around infection prevention and control in care homes, and we continue to do that. And as I said, the Health Secretary will particularly address next week in Parliament one of the things that the report does seem to find, which is the most significant factor in outbreaks was the size of care home. That is not blaming care homes, and it is not blaming staff. It is simply recognising that bigger care homes, there are perhaps more interactions, there's perhaps more of a risk of community transmission getting into the care home. So we have to think about how we work with and support larger care homes to better mitigate that. So this is about understanding what the drivers are. Excluding some is one part of that, or if not excluding completely. And let me be clear, this does not say that hospital discharges in all circumstances, that there was no factor at all. It just says it wasn't a statistically significant one. But that doesn't take away from the need for us to learn about what did happen in care homes, so that we can make sure we make the changes that are designed to minimise and mitigate that for the future. Peter Smith from ITN.
Thank you, First Minister. There have been more than 1,000 deaths in care homes with coronavirus in this pandemic. I've just spoken to the widow of one of those deaths. When I told her that there were 356 people who had tested positive for coronavirus and had been discharged into Scotland's care homes knowingly, she said that she felt numb. She called it a disgrace. The widow of one of these coronavirus deaths in care homes has asked me to ask you, who was responsible for this decision?
I take responsibility. I have never stood here and shirked my responsibility. Ultimately, all aspects of this pandemic, how the Scottish Government and our partners have responded, I take responsibility for that. I've never tried to say otherwise, and I never will try to say otherwise. Clearly,
First Minister, you said you didn't know what was going on.
Look, I'm desperately trying to address this properly, but you have to understand some of the differences in the kind of decisions that are taken here. So, yes, we knew, well, firstly, the Scottish Government is responsible for the guidance that guided when and in what circumstances people were tested. And up until, I think, from memory, the 21st of April, we did not have a policy that tested everybody discharged from hospital to a care home. That was part of a wider set of decisions around testing at the time that were informed by our understanding of the virus and the efficacy of testing at that time. That changed. The Scottish Government is responsible for that guidance. Yes, of course we were aware there were concerns about where people going into care homes without being tested contributing to outbreaks. That is why we commissioned this report. But I don't take individual clinical decisions. So I don't know in individual cases, I didn't know that there were particular people who had tested positive who went to care homes. I am not a clinician. I don't take these decisions. The clinicians who do take these decisions take them with all of their expertise and care for their patients. And of course, the report sets out some of the clinical reasons as well as policy reasons why in some circumstances individuals, particularly frail elderly individuals, wouldn't be tested. So in terms of the person you've been speaking to, Peter, I don't expect anybody who's lost a loved one in this virus, and particularly in a care home, to feel any differently. But it is important, and it's not me saying this, it's the independent authors of this report. And this is not, and this is really important to be clear about, it's not me saying that the people who died in care homes don't matter. But the report finds that whether people were tested or not, whether they tested positive or negative, there is no statistical evidence that that was the driver of outbreaks in care homes. Now, as I said in response to the previous question, that doesn't change the fact there were outbreaks in care homes, and we need to understand why and how to minimise and mitigate against them. But to say that they were caused by the testing issue is not borne out by this report, and that's just a fact that people can look at themselves. And as I say, this is an independent report. It's not one that the Scottish Government has done itself to reach a preferred conclusion.
First Minister, you may say that it's not statistically significant, but surely you would concede that it's downright dangerous to send 356 people who had tested positive for coronavirus into care homes. And the question we're trying to get to the bottom of is who is responsible for doing that?
Individual clinicians will decide. Well, I think I've answered that question. I'm responsible as the head of the Scottish Government for... Peter, it might help you...
Did you know that it was happening? Did you know it was happening?
Peter, it might help you if you let me answer and actually listen to the answer I'm giving you. I knew what the policy was. I am responsible for the policy. And up until the 21st of April, the guidance did not mandate routine testing. So I am responsible for that. I'm responsible then for ensuring that we, and that was not because we didn't care about people in care homes. That was at a stage of the pandemic where we didn't have the same understanding about asymptomatic transmission, and we didn't have the same views as we have now flowing from that about the efficacy of testing people without symptoms. So that was not something we'd just shrugged our shoulders and said we don't care. We were acting on the basis of the best evidence. At that point, the judgment, informed by clinicians and our expert advisors, was that the focus should be, and this is actually still the case, notwithstanding the changed position on testing, should be on infection prevention and control in care homes and isolating residents within their own rooms and not having communal activity. So that was the judgment reached then. That changed as our understanding of asymptomatic transmission and testing changed. I'm responsible for policy. But there will be a variety of reasons why clinical... So even with a policy that says that everybody should be tested, there will be some circumstances in which a clinician decides that's not appropriate. I'll hand over to a clinician in a second who can explain that from that perspective. I am not, nor should I ever be, responsible for clinical decisions that are taken in the care of an individual patient. And I think most people understand that distinction. I am not and never will shirk my responsibility here. That's why we commissioned this report, to get an understanding. None of this can be in any way diminished, but nor can the conclusion of the report. The conclusion of the report is very clear that it is not discharge from hospital to care homes, regardless of the testing status of people being discharged, that was the significant factor, or a statistically significant factor at all, in whether care homes had outbreaks or not. And that, I'm afraid, is a conclusion that you can't simply brush over. I'll hand to Gregor to give a clinical perspective.
So the decision to discharge from hospital, whether it be to a care home, whether it be to a person's own place of residence, is always clinically led, and it involves a very detailed risk assessment of the individual to see whether there are any reasons, particularly clinical reasons, as to why that person should not be discharged to that environment, and in fact whether it's safe to do so. And all that was part of the guidance right back from the beginning that was originally produced at the beginning of March. Now, as our evidence and our understanding of the virus has changed over time. We've begun to evolve that evidence, taking account of changing WHO evidence around about it, taking account of the different place of testing that we have had evidence for over time as well. I think there are two very important features of the report that has been published by Public Health Scotland today. And the first of those is the contribution that it has to accountability in terms of us being able to understand exactly what happened to those people who died in care homes and develop a much better understanding of the reason why there were outbreaks in that environment. But the second part is about learning. And it's really important that we don't disrespect the findings of what has been a very complex study to try to get to the bottom of what learning there is to be gained from why these outbreaks happen. Because if we do disrespect those findings, we don't get the benefit of that learning, be able to play that back into the system to make sure that we don't have that situation arise again.
Whether it be to a care home, whether it be to someone else's place of residence.
Thank you, First Minister. So fundamentally, does the government accept that discharging nearly 3,000 untested hospital patients into care homes in March and April will indeed have caused some of the fatal outbreaks? We appreciate this is a very difficult situation for families, medics and government ministers. And Dr. Smith was just talking about the learning there. What is being done just now to address the second outbreak, the second wave?
You gave her a bit of a swipe there, mate.
Sorry, I'm getting a lot of feedback. I can see Peter Smith still on the... Can you cut your connection, Peter, because we're hearing you? Okay.
I've muted myself, First Minister. I don't know what's going on. I've muted myself.
Well, if you can mute yourself again, that would be good. Andrew, in terms of the first part of your question, I can only quote you what is in the report, that there is no significant evidence that the testing, that discharges from hospital, regardless of whether people tested negative, positive or were not tested at all, were associated with outbreaks. Now, as I said, the authors of the report are doing a briefing for journalists later on, so that will be an opportunity to ask them those questions, and they can give you the answers completely objectively, because they are not the ones with accountability for the pandemic. But I'm quoting you the report that says there is no statistically significant evidence of that. But the equally important point I want to make is that that doesn't mean there were no outbreaks. And we have to understand, and this is an ongoing process, of what does contribute to outbreaks in care homes. And hopefully, as we go further into the second wave of COVID, a lot of that learning will already be having some effect in trying to minimise the chances of that. So nobody is trying to say that outbreaks in care homes are not important, but I can't stand here, and I'm sorry if this is not the conclusion to this report, this is the conclusion to this report, that there is no significant evidence that that factor drove the outbreaks. It doesn't mean that the outbreaks didn't happen or that we don't have a responsibility to understand them and prevent them in future. Gregor. And it was a part of the question to you on...
Could you repeat the part of the question for...
I think it was learning for the second wave.
It was just about what we're doing to prevent, what measures we're taking to prevent the second wave affecting care homes just now when it comes to discharge from hospitals. Thank you.
So as you know, we've been updating the guidance into for patients who are discharged from hospital to care homes all the way along. There's been various iterations of that guidance which have been published, and we continue to look at a variety of aspects of this, whether that be the testing of patients before they enter a care home from either a hospital or a community setting, whether that be the infection prevention and control mechanisms that are put in place in these care homes, and how those care homes are supported in making sure that they can deploy those, and also in the use of protective equipment within those care homes as well. So that is a continual process. It's overseen by a variety of groups that we have who produce guidance for those care homes. The Chief Nursing Officer and myself have commissioned a group of very senior clinicians to work with that sector in making sure that we continually adapt that guidance and make sure that it remains fit for purpose in light of any more emerging evidence that comes through. And I'm quite sure that they will consider the outcomes of this report to make sure that they are renewing that information in time as well.
Sorry, I've just asked Andrew Kerr. Becky Clark from Global.
Good afternoon, First Minister. If I may touch on the issue of hospitality and the restrictions coming in next week, we've spoken to a restaurateur in Edinburgh who, if as expected they move into level 3, will only be able to open until 6 o'clock, with no alcohol. He says that just isn't viable for any of his businesses. The Scottish Hospitality Group as well putting forward their own proposals on what levels 0, 1, 2 and 3 should look like to make it viable for all hospitality businesses. Now, if businesses decide that it's not viable for them to open under the level of restriction that they're facing, what support will there be for them?
Firstly, and this is not intended to take away from how difficult this is for businesses in the hospitality sector, but the scenario you've described there where a restaurant, I think it was in Edinburgh, will only be able to open to 6 o'clock without serving alcohol, that is actually an easing of restrictions compared to what is in place in Edinburgh right now, where they can't do that. It's only if you're a cafe that you're able to do that right now. So that is actually, this is not about tougher restrictions coming into place next week. For many businesses, it will be broadly the same restrictions, but actually in many respects, there will be a slight easing of them. In terms of the overall question, I know how difficult this is for businesses, but as I said earlier on, I cannot magic away COVID. It is there. It spreads when people interact. It spreads more easily in certain environments, and therefore we have to act to minimise that. And we're trying to do that in Scotland as effectively as we can, but as proportionately as we can as well. If you live in Wales right now, hospitality is closed completely. Similarly in Northern Ireland and in the Republic of Ireland and in increasing parts of Europe, this is not about opening hours. You are just seeing a complete closure of hospitality. We want to try and avoid that if possible, which is why we're taking this tiered approach. That doesn't make it easy, but we have to get the balanced decisions right to keep the country as safe as we can from this virus, because we see in the figures what a threat it poses to life, health and to the National Health Service. And in terms of support, we set out the business support that we will make available to businesses if they are either required to close or significantly have their trading restricted, and that mirrors the support available to businesses in the rest of the UK. We are making the case continually with the UK government that they should make it possible to do more for businesses, but we will continue to do the absolute maximum we can. And I think you asked about proposals the industry had put forward. We will, and I said this in Parliament yesterday, we will continue to talk to the industry about whether it is possible to make any modifications to the detail of the levels as we go forward. But it is not going to be possible, and this is a really hard thing to say, and it's a hard thing for industry to hear. It's not always going to be possible to accommodate all of the asks that businesses want while still suppressing this virus. And these are the really difficult balanced judgments that we're going to have to continue to arrive at. Tom Eden from PA.
Thank you, First Minister. Good afternoon to you both. I also want to ask about the Public Health Scotland report on discharges into care homes. You said, I think in response to Peter, that the government changed their policy. But even after that, between the 22nd of April and the end of May, 112 people were still discharged into care homes without being tested. I know the CMO just then touched on there may be clinical reasons, but can you give any assurances that there are safeguards in place that these people have not just slipped through the gaps or the guidance has been ignored?
We will always do everything we can to make sure guidance is being properly applied. We're never complacent about that. The NHS is a big, complicated system. But the report itself addresses this point to some extent, and I appreciate it only was published just shortly before the briefing started, so journalists will not have had an opportunity to read it in detail. But if I read from and I can refer you to, I think it's page 15 of it, it sets out some of the reasons why an older person might not be tested prior to discharge. For example, it might be clinically inappropriate because the person might be at end of life because of the invasive nature of the test. It might cause distress to a person who's old and vulnerable. It could be a clinical decision based on symptoms. These are some of the issues. So sometimes these will be clinical decisions, and it comes back to the point, I do not, and nor should I ever, be involved in the clinical decisions that clinicians reach about individual patients.
I think it's really important that we understand that sometimes there's some very complex ethical deliberations that clinicians have to go through in deciding whether to put someone forward for a test or not. And part of that is about people's own capacity to be able to consent to that test as well. That's a kind of fundamental and founding principle of actually how you approach care. Beyond that, there's also other clinical considerations as to why people may not have actually had a test. For those of you who've actually had a COVID-19 test up to this point, many of you will now realise it's sometimes it can be quite uncomfortable. And if you can imagine yourself in the position of a frail older person who perhaps has been quite ill, sometimes even receiving that test can be quite an undertaking for them. So all these things are considered, and I think it's particularly important when people are receiving end-of-life care, which is not infrequent in these circumstances, is that those ethical considerations are at the forefront of clinicians' deliberations when assessing whether someone should have a test or not. The one thing I would say is that whether people have a test or not before discharge, as I say, to whether it be to their own home or into a care home, is that each of those individuals continue to be risk assessed for that environment, and all the infection prevention and control mechanisms that should be deployed in that risk assessment are still undertaken.
Conor Matchett from the Scotsman.
Thank you, First Minister. Also on the Public Health Scotland report, I'm just reading it now. There's a line in it that states that the analysis only examines whether hospital discharge is associated with the first ever case in a care home, and it is possible that hospital discharge after the care home has had some cases causes additional infection, but the analysis method used cannot examine this. I'm wondering why, however many months we are into this pandemic, we are no further down the road in knowing what caused and why care homes were so badly affected by COVID-19. This report clearly doesn't help us. You've admitted that yourself. It's not statistically relevant. So why don't we know what has caused this? And presumably that leaves the whole of Scotland open to more care home deaths because we don't know how to prevent it.
I absolutely refute, I think, 90% of the basis of that question with the greatest of respect. You just used a phrase there that is completely and utterly wrong. You said the report was not statistically relevant. That is not what the report says. The report says there is no statistically significant evidence that discharges from hospital to care homes were associated with outbreaks. The gulf between those two statements really couldn't be any greater. And, you know, I am responsible for Scottish Government policy and the application of that. But, you know, is it too much to ask for people to properly read reports that they're questioning me about? Don't just make sweeping assertions that are completely wrong. In terms of the methodology that they...
First Minister, apologies. Poor wording on my part.
Okay, in that case, my apologies for maybe reacting in the way I did. But these are really important issues, and I've got a responsibility to treat them seriously, but I think everybody commenting on them has a responsibility to treat them seriously as well. But I accept that, Conor. And the second point, which is a legitimate point that I can't answer because I'm not the author of the report, is about the methodology of the report and the limitations of the methodology. That's why the authors of the report with the Chief Nursing Officer are doing a technical briefing later today with journalists, which I don't know if you're attending, but you are able to, or one of your colleagues can, so that they can go through the methodology they use, why they chose that methodology, what the statistical limitations of that methodology are. Not just because I'm not the author of the report, I'm not a statistician, I'm not qualified to comment on that, but they definitely can and will be able to answer those questions. And on the more substantive point of your question, which is an important one, is what do we understand about care home outbreaks? What can we assume about care home outbreaks? And this is where I'll get non-technical and probably speak a bit as a layperson, and what work do we still need to do? And before I very briefly comment on that and ask Gregor if he wants to add, Scotland is not unique here. What we've seen in care homes has been seen in many other countries in the COVID pandemic, and some of this learning and understanding has been developed in countries across the world. So this is not just a Scottish issue. In terms of what this report, I think, starts to help us with, and as I say, this is not about blaming care homes, is that one of the most significant factors in looking statistically at whether there were outbreaks in care homes is the size of the care home. Now, again, as a layperson, more people, more interaction, perhaps more people coming in from the community, so more of an opportunity for community transmission to impact the care home. What, as a layperson, I think we can all understand is that this is a virus that affects older people much, much more than it affects younger people. And care homes tend to be populated by older people. So there is a correlation there. And also we know in terms of the frailties and the likelihood of somebody when they get COVID dying increases as they get older. But there is still work that Scotland, in common with other countries, have to do to better understand this. We're understanding and applying this as we go. So we have changed our position on testing. And the reason for changing that, as I keep saying, is not that we started out not caring and then decided we better. It's the knowledge and understanding of the virus, how it spread, what the role of testing might be has evolved over time, and we have changed policy in line with that. The Health Secretary will say more next week about how we're going to try to mitigate the size of care home issue. So that work is ongoing all of the time. And while there is not an ounce of complacency on the part of any of us, I hope as we go through the winter, we will see the effect of that work in the experience of care homes across the country.
So I mentioned earlier in answer to a previous question that it's really important that we take learning from reports like this when they're produced. And one of the things that strikes me about this report is the influence that care home size has on the degree of risk, and we need to understand exactly why that is better. We know from now this study, from other studies produced, for instance, by Public Health Wales, but also from experience around the globe, that vulnerable institutions like care homes sometimes find that their experience is very reflective of what goes on around them in the surrounding community. And one of the other features that we have noted in terms of the care homes across Scotland is that those areas who have experienced some of the worst aspects of community transmission also experience some tragic circumstances within those care homes as well. When you look at the influence that the size of care home has on the findings here, it does make you wonder about whether contact and footfall is an important feature. But I think those are aspects of this that we need to understand in a lot greater sense before we start to respond and strengthen the protections that are around about these places. These are people's homes, and it's really important that we don't just cut people off from their communities and their loved ones in a way that actually has a harmful effect on them as well. So somehow we need to find better ways of making sure that we can maintain contact from those inside a care home and those outside a care home to make sure that we don't experience some of the tragedies that we saw earlier on in this year.
Just a final point about the importance of all of us trying to understand this properly. That's obviously particularly important for those of us in decision-making positions, but it doesn't do anybody any good if we latch on to things that independent analysis are telling us were not the factors or not the greatest factors here, because that would divert us from actually trying to understand better what the factors were. If I'm being honest, I expected this report to probably reach a different conclusion to the one that it has, because I think intuitively you would think that would be the case. So I don't criticise at all people for saying, but surely discharges from hospital and the testing status must have had an impact. I, as I say, would have expected the report to point more in that direction, but it doesn't do anybody any good when it hasn't to continually to try to say that it does it, because that means we have to work harder to understand what the drivers and the factors were, and that is, as I say, work that we take really seriously. Tom Peterkin from... Sorry, Connor.
Sorry, First Minister, just to perhaps better phrase my question. My question is really why, given 9 months into the pandemic, have we not done more of that work looking into the factors? This obviously excludes one factor, but as you've discussed, learnings have to be made. We're in the middle of a second wave. Why hasn't more work been done?
That's a fair question, and I think we have done a lot. I think, as far as I know, we're probably one of the only countries, I don't know this for sure, but based on my kind of impression, there's not many countries have done the detailed work that Public Health Scotland have published today. But our learning around this continues all the time. The change in the testing position, even though this report's saying that wasn't the big significant factor in outbreaks that we might have expected, that has changed because our understanding of different things that drive these kind of decisions have changed. We've changed already the governance around care homes with directors of public health, much more responsible for the oversight of that to make sure that guidance around infection prevention and control is properly being implemented. So, there's always more we can do, but I think, and I'm happy to be corrected if evidence can be found from other countries, I'm not sure that we are behind other countries in trying to learn from this. I think we're doing a great deal, and we want to carry on with that so that we understand not just this aspect of COVID, but all aspects of it. But, we come back to the point, this is still, even although it seems as if we've been living with it forever, this is still a relatively new virus, and there are aspects of it and how it affects people and how it transmits. And it's not that long ago that, and they may still be, scientists are still divided on whether aerosol transmission is a big driver. So there's lots about this virus that we just don't yet fully understand, and that has a factor in trying to understand issues like what drives outbreaks in care homes. So we will continue to do as much of that as we possibly can, because it's in everybody's interest to have as detailed an understanding as we possibly can get to. Do you want to add anything?
Yeah, I just wanted to kind of reassure you, Conor, that there are multiple research projects which are underway across Scotland just now, looking at various aspects of COVID-19 and the response that we've had. If anything, I would suggest that perhaps Scotland's punching above its weight for a population in terms of the volume of research that is currently underway. Most recently, there's been a call for applications for funding for more research on, for instance, the so-called long COVID, so that we gain a better understanding of that. But good, high-quality research necessarily takes time, and it's the thoroughness of reports like this that give me confidence in the findings of it, and we need to make sure that anything that we are basing important decisions on has that rigour about it and the quality assurance to make sure that we can start taking those decisions.
And it's important that government, supports and where necessary we commissioned this report not knowing what it would conclude. As I said, I probably would have expected it to conclude that discharges from hospital had a bigger impact. But government, regardless of that, has a duty to make sure this research is happening. And that's why reports like this are such an important part of the process. Thanks, Conor. Tom Peterkin from the P&J.
Good afternoon, First Minister. Local politicians in Perth and Kinross are angered because there are signs that NHS Tayside wants to put Perth and Kinross into a Tier 3 lockdown, just like Dundee City Council. This is despite the huge disparity in cases, with Dundee recording far more than Perth and Kinross. And I appreciate that you said that there are other factors other than simply the raw data in your answer to Peter McMahon. But Perth and Kinross Council leader Murray Lyle has said that he's very angry about this and it will have a huge impact on Perth. So are you confident that are you still confident this is the right approach?
We haven't taken final decisions. We will reach these decisions later on the basis of advice from clinical advisors, the National Incident Management Team, informed by the discussions with local authorities. And government has to reach these decisions, and they're not easy decisions, but they have to be taken by somebody. I won't repeat everything I said to Peter McMahon, and I think this is the kind of decision-making process and the factors that guide these decisions that we are all going to have to get used to and better understand over the next few weeks. But I suppose Perth and Kinross actually, in some ways, illustrates one of the points I was making to Peter, that councils in Perth and Kinross may, and I'm not criticising them for this, they may feel aggrieved at NHS Tayside for thinking a particular thing, but Perth and Kinross residents depend on NHS Tayside hospitals and intensive care units, so they cannot be divorced from that wider health ecosystem. and nor can they simply be, plucked out of Tayside. So if you have a situation, which we may well get to, if not next week, then in future, I'm certainly not ruling that out, but these things have to all be weighed, where, Perth and Kinross has, pubs more open, and then people from other parts of Tayside, regardless of our advice, come there, then that potentially exacerbates a situation, and it's the same ICU beds and hospital beds that are then having to treat people. So this is going to be the difficult part. I speak personally here, again, as a non-expert. It's the part I find most difficult in these decisions, about how you have to take raw statistics and then apply some common sense and judgment and factors that are just about how people live their lives in reaching decisions. And I think it's going to take a bit of time for all of us, councils and the wider public to really understand that. But the alternative is we just have a one-size-fits-all across the country, and that's not appropriate either. We need to get to a more targeted and proportionate approach to this to allow people, where possible, to live more freely. But getting to that is not always going to be straightforward, and we're all going to have to understand the trade-offs and the balances involved in it. You all right with that, Gregor? Do you want to add anything?
I think it's a good demonstration of the nuances in the discussion, and the local intelligence around about patterns of travel, pockets of infection, all get taken into account. But I think the really important aspect of this is that at this current time, discussions are still underway and no decisions have been taken.
Mark Corn from the Times.
Good afternoon, First Minister. My question is about students. Will students be able to return home after Christmas? Will students be able to work from home after Christmas, or will they have to physically return to campuses and halls of residence?
Look, we'll set that out when we've done the work that governments across the UK are doing. We're trying to align that work as much as possible, and nearer the time when we've got a better understanding of the virus. I would love nothing more, and I know people watching would love nothing more than me to be able to stand here and give certainty about the position at Christmas and the position in January. It would make answering these questions easier if I could do that, and it would make everybody feel better, but it's not possible, and it's important that I'm just open with people about that. We have to go through this next period. What we do know is the more we can drive the virus down just now, the more chance we have of greater normality at Christmas than we've got now, and the more chance of normality as we go into next year. But we have to take those decisions on a basis that allows them to be informed by the most up-to-date evidence and the most up-to-date thinking. Chris Mawson from The Sun.
Hi, First Minister. Just two things briefly. The chief executives of the Lanarkshire councils and NHS and the area's police commander have written a letter to you, or rather John Swinney, asking that they are not placed in the top tier of the COVID restrictions, and they say that the situation there is improving and that significant additional harms and consequences would come from such a move. So what would you say to that? And then just on care homes, you keep quoting a specific line from the Public Health Scotland report, but the report also says that it cannot exclude a moderate to large excess risk from a care home receiving a discharge where the last test was positive. So focusing on these positive discharges, not the untested ones, the positive ones, did you know all along about people who had tested positive being discharged to care homes?
I would not have ever stood here and said it wasn't happening, but I didn't have details, specific details that would have allowed me to say, I know X number of people were tested positive and were discharged to care homes. I've tried to think of how I can make that clearer, because I'm not trying to evade the question, but that's about as clear as I can make it. I'm equally not trying just to pick on specific lines from the report. I'm quoting the conclusion of the report. I said in my opening remarks that and I actually went into detail about what it meant by discharge of any kind, where people tested positive, tested negative, or weren't tested at all. And I said that the degree of certainty about that conclusion varied in each of these scenarios. But it is a variation on from a baseline of them saying it's not statistically significant. I'm not trying to cherry pick. There's lots in this report. It's actually quite a tough read for a layperson like me, and no doubt like you, although you'll possibly be better at it than me, because it is very statistical. But that's the conclusion it reaches, and you'll have the opportunity later to if you're able to make it to question the authors of the report, who can go into more detail about what their conclusions mean and don't mean. And if they think I'm being unfair in how I'm quoting their conclusions, they'll be able to say that to you. But I'm simply quoting, and I deliberately read from the report rather than paraphrased it to make clear that I'm not trying to make it sound better. And coming back to the point, if I was standing here and saying, look, this report says it wasn't hospital discharges, so there's nothing to worry about in care homes, I'm not saying that. It doesn't do anybody any good to latch on to something that a report says is possibly not the biggest driver, because that then means we're not thinking about what are the big drivers. And none of this is about trying to take away from the fact that there were outbreaks in care homes.
Surely, First Minister, there's scope to do both. We shouldn't ignore lines in this just because there's a greater cause established either. I'm
not ignoring anything. The Scottish Government commissioned this report. We're not ignoring, and will not ignore a word of it. But equally, I'm not going to stand here and ignore the fact that its central conclusion is, as I've said. Now, as I say, that doesn't mean that we didn't have outbreaks in care homes, and that we don't have to understand what all of the factors were, and that for wider reasons we change the policy in line with changing understandings around testing. So maybe I don't always articulate this as clearly as I can. There is no part of me trying to kind of evade these issues. And there's no part of me trying to evade the accountability for these issues. I desperately want to understand some of, before I say this, please don't take this as me saying that this is a great big trial for me. The people who matter here are the people in care homes and their relatives, but probably some of the darkest moments I've lived through were at the height of what was happening in care homes earlier in the year, and knowing that decisions I was responsible for were impacting that. And I only say that to try to get across to people that I don't always get these things right, the government doesn't always get these things right, but never ever think I don't care about this and that I'm not striving, and we weren't striving every day to get these things right. And that's, I suppose, all I'm trying to get across to people. Can I maybe take your...
I just check real quick. Mm-hmm. It's just we still don't know, having questioned you about this the other day and today, at what point you actually became aware about positive discharges to care homes, just them happening in general, not the specific details of them, but them happening in general. I just wonder, can you just be a bit clearer on that?
I'm not sure I can put a precise date on it. You know, Chris, because you've been asking me about it, that the issue of were people being discharged to care homes where they might have been tested positive, I can't stand here right now and put a date on when that started to be something that we were conscious of and that we were being questioned about. But I've never said that I wasn't aware of that possibility. But I wasn't aware until the information came to light. And then, of course, that's the reason we commissioned this report, to take our knowledge from general knowledge into much more detailed knowledge. I don't stand in a hospital and be part of the decisions in individual cases. So I didn't know whether in actual fact X number of people had been sent to care homes having tested positive. Now, I could have decided that I never wanted to know that and not commissioned this report, but we commissioned this report because we wanted to make sure we had deeper understanding of that. Again, I am not trying to evade that question. I'm trying to answer it as frankly and openly as I can. And we commissioned this report. This report could have come back today, and actually I might have, as I said to I think Connor earlier on, that probably was my private expectation, that this report would have come back today and said care home outbreaks were largely caused by people who hadn't been tested going into care homes. We didn't allow that possibility to deter us from commissioning this. And had that been the conclusion of the report, I'd still be standing here today answering your questions about it. I am not trying to evade this. It matters to me to understand this as deeply and as detailed a way as we possibly can. And actually, if I can do something I don't do very often, and maybe should do more often, pay tribute to the questioning at these briefings, because that is an important part of the process as well, of making sure that we do think, is there an issue here we should be understanding more? And this is one example of that, but There have been many examples over the past 7 months when I've left this briefing to say, look, is there an issue here that we should be looking at a bit more? So this is all part of a process of accountability and scrutiny that is sometimes not comfortable for me, but that's part of my job. And you can disagree with me vehemently. Many of you watching will on a whole range of things, but please never doubt that I take this really seriously, and I don't want to evade any of the responsibility because it matters to all of us to get this right. You asked me another question, which I will just come on to, which was about Lanarkshire. What you said there, I mean, I covered this in Parliament. I acknowledged in Parliament yesterday that there were encouraging signs about a stabilisation in Lanarkshire. I have been told nothing that changes that assessment, although I have a meeting with advisors later on to sort of look at the final evidence around these decisions, but I'm not aware of anything that is changing that assessment in Lanarkshire. And what I said yesterday remains the case, that we do not want to put any part of the country into level 4 if it is not absolutely necessary. And while I can't say categorically, because I haven't done that final part of the process, I very much hope that tomorrow we will not be putting Lanarkshire into level 4. Can I rule that out forever? Can I rule it out forever for any part of the country? No. But we will only use that top level. It's there for a reason. It's the most severe restrictions, and we will only use it if we think it is really necessary to get dangerously high levels of transmission that are threatening to overwhelm the NHS down in a quick and decisive manner. Do you want to say any more about Lanarkshire?
So Lanarkshire is one of the areas across Scotland that we've been tracking particularly closely, as you realise, because of the high numbers of cases that we've been seeing there over the last few weeks. And it's correct to say that there are some encouraging signs that we may be starting to see some cresting of those figures, and indeed might particularly plateauing at this moment in time. We continue to keep a close eye on that. Final decisions have not yet been made. We will see the outcome of discussion today at the National IMT. We will take that and the latest data into further discussion over the coming hours before making any final recommendations to ministers about where, on public health grounds, we think that the Lanarkshire local authorities should be placed.
Right, we've got a few questions left, so I'll try to speed up a little bit. Simon Johnson from the Telegraph.
Good afternoon, First Minister. I was just seeking some clarity on the travel advice that will come into effect when your 5-tier framework starts on Monday. Currently in the Central Belt, obviously we're advised to stay within our local health board area. However, a table that the Scottish Government published yesterday advised in level 3 areas, which you said probably will be the Central Belt, and no non-essential travel in or out of the level 3 area. I just wanted to get clarification on whether that means no travel in or out of the council area rather than the health board area.
I would say that's pretty self-evident. If you are moving to a situation where your levels are applied at a local authority rather than a health board area, and if you have different councils and different levels, then if you have advice not to travel from a high level to a low level or vice versa, then it is pretty self-evident. I would have thought that applies at council level, not health board level. So
that just seems like pretty major implications for businesses, for example. I mean, just picking one from Edinburgh. I mean, Edinburgh Zoo, you'd only be able to go there if you lived within the city of Edinburgh.
Yeah.
Are you planning to provide any more financial help for businesses in that situation when you're essentially restricting their customer base from, a relatively large area to an extremely small area?
Remember, well, firstly, we will set out the decisions we take when we take them, and we'll set out what the corresponding travel advice is around these decisions. Levels 2 and 3 and definitely level 4 are only intended to be in place for as short a period of time as possible. We don't want any part of the country living in one of these levels for extended periods of time. They are what we've described internally as the braking levels. Levels 0 and 1 are where we want to get the country on a sustainable basis, where these are the levels you would want people to be in. But come back to this. This is about trying to contain a virus, and some of the implications of that are really unpalatable. But there's no point in me trying to suggest otherwise. And we look within the resources we have at how we best support businesses through that. But the way we best support businesses is to get the levels of transmission down so that parts of the country don't have to be in these higher levels. And when they are in these higher levels, as some will be for the next period, it's as short a period as possible. And this is really difficult, but that's what is involved when you're trying to stop a virus spreading from one area to another. David Ball from the Herald.
Thank you, First Minister. Going back to the Public Health Scotland report, as has been mentioned, it says that care home size is much more strongly associated with the risk than the discharges. But on June the 4th, Jean Freeman told Holyrood's Health Committee that smaller care homes appear to do better in terms of handling the virus. Given that was known in June, have larger care homes been given any sort of tailored advice or rules, given the Scottish Government has been aware of that increased risk for almost 5 months?
Well, obviously, by definition, based on your question there, it's not something we've been trying to hide. It's been a fact. This report confirms that size of care home is a factor, and that is part. So we now have, I'll ask Gregor to say a bit more about this, but we now have a sort of governance structure in place that where public health directors with local authorities, with care home providers make sure that the infection prevention and control in place is appropriate, that guidance has been followed, and some of these decisions will be relative to the size of the care homes. And that's part of it. The testing programme is important in terms of making sure, whatever the size of care homes, that we are reducing the risk of infection going into care homes. So that has been part of our thinking for a while. But of course, the conclusions of this report will allow us to tailor that even further. And as I say, the Health Secretary will say more in Parliament about this when she makes a statement on the winter planning for social care next week.
Thanks. So since that time, and indeed before that, our directors of public health across Scotland and also our executive nurse directors have been working very closely with care homes in particular to support them, and they've been targeting that support and that help at those care homes that perhaps have flagged that they need it most, either because there is evidence of existing outbreaks there, or because they've been risk assessed in a way where we would want to be able to support them further. And that's sometimes involved staff from NHS backgrounds supporting care homes in ways just to try to improve approaches to infection prevention and control, the use of PPE, and the general approach to how we care for patients in that COVID environment as well. So that will continue just now. That level of support is something which has been, I think, beneficial for everybody who's been involved with that, and we'll make sure that the new evidence as it develops is fed into that process as well.
Rachel Watson from the Mail.
Thank you, First Minister. I just wanted to ask, there's stories around today about concerns around capacity for hospital wards having to close. And then at committee this morning, it was raised around the issue of some areas with lower prevalence of the virus could be in a higher tier because of their local or regional hospital. I wondered, how much weight will hospital capacity have when you're deciding on the tiers? And also just on the care home report as well, in response to Chris, you said that you would never have been able to stand there and say that the discharge of patients into care homes who'd had a positive test wasn't happening, but you didn't have specific details. And I realised what you said around the timing of that, but why did it take a newspaper article on this for this report to be commissioned? Couldn't that have happened earlier?
Happen earlier, and whenever we do things in whatever circumstances, perfectly legitimately, people will ask me, should you have done it differently or should you have done it earlier? And that is part of scrutiny. And we're trying to do our best here. We could not have, we could have decided not to ask these questions because if you don't ask the questions, of course, journalists never get the answers, and we didn't know what the answers would be here. But it's because we want to understand that we've gone further than I think most other countries to try to delve into this. And yeah, you can always do things earlier, but the important thing is we've done it, and the report is there. It can be read, it can be scrutinised, and we will take all of it very seriously. In relation to the first part of your question, I won't repeat everything I've said, which I assume you heard earlier on, but we're not going to, so if you look at the statistics that will be part of the consideration, it's not going to be a weighted process. It's not going to be 20% to cases per 100,000 and 20% to test positivity and another 40% to hospital capacity. It will be a rounded judgment taking account of all of these things, and it has to be that, but that of course does make it more difficult to explain exactly what the key factor might be in deciding whether an area is in one level or another. But of course hospital capacity is important here. I said something in Parliament yesterday that is worth repeating from the statistics. There are, it's 17 more today. There's 1,117 patients in hospital with COVID right now. Back at the peak of the virus in April, the highest number we had in hospital at that time was 1,500. So we are not far away from that peak. And that then, the more people in hospital with COVID, the more pressure inevitably ends up being on our frontline workers who continue to do an extraordinary job and on services for non-COVID patients. So, coming back to this objective that we all, I think, really understood earlier in the year, that part of the reason we are all making all of these sacrifices right now is to stop, hopefully, ourselves getting COVID or passing it on and stop people getting ill and dying. But it is also about all of us working together to protect the National Health Service. And that is more important now than it has been at any time since March, April. And that does mean the areas, on some occasions, it will be a factor areas where all of the other things mean that perhaps they've been another level, but the fact that they rely on the same healthcare as people in surrounding areas might mean that they have to be in a slightly higher level in order to make sure that we keep the overall numbers of cases down. So these will be difficult judgments, and it's important that we get them as right as we possibly can, because all of us are trying to suppress a virus here, and unfortunately there's no exact science. I think it took me a while to understand this, and I think it perfectly understandably, if you listen to the parliamentary debate at all yesterday, a lot of MSPs, again, understandably and legitimately, were saying, give us the evidence of this or give us the evidence of that. And we do that as best we can, but this is not an exact science. And that makes these decisions both harder to take, but also harder to explain. But I will continue to do my best as we go through this to give people an understanding of why we're doing certain things and what we ask people to do as a result of that. Do you want to say any more about hospital capacity?
I think it's really important that we not only factor in hospital capacity, but it's actually a critical component of all the data that we consider this. Why is that? Because at this point in time, we have a very different approach to how we treat COVID compared to those early months of the year when we first started to experience cases. We've got more treatments and more understanding of the virus that are available for us. Therefore, it's right and it's proper that we factor into the consideration what hospital capacity is available to treat patients. And we're no different from any other areas of the world, all of whom use the hospital capacity at their disposal as part of the consideration in terms of how they respond. The prime part of our response in terms of how we contain and suppress COVID-19 at this moment in time still relies on the non-pharmaceutical interventions that we've become used to. But as I say, as we get more treatments available to us, it's important that we maintain that hospital capacity for those who will benefit from it.
And the last question today is Richard Percival from the Daily Express.
Thank you, First Minister. I just wanted to ask about care homes. I know you've covered a lot of it already, but there's a lot of families that are sort of been asking for answers into this report. What would you say to those families today, and would you apologise that this report has been delayed and taken such a long time for it to come out? And secondly, just on Christmas, would you consider a 48-hour relaxation of rules so families can see each other during the Christmas period? Thank you.
There's of course a connection between these questions, which I'll try recognising the sensitivity of both parts of the question to kind of explain as we go, although I think most people probably understand it. To families of people who've lost loved ones in care homes, what would I say? What I've said before, there are no words. I don't have the words to properly convey how sorry I am for what you've gone through. And any part of this response that we've got wrong, even if for the best of reasons, I'm sorry about that. I'm never going to shy away from that. And we try to learn and we try to get it better. The delay in the report is not something I can or should apologise for, because it's an independent report, and the reason it's taken the time it has is because of the complexity of it. The need to bring different data sets together to do it properly, and I don't think the authors should apologise for that either, because the time it's taken has meant that it is a really robust report, and that means that the information in it is richer and more reliable for people, and the conclusion it draws, I think we can have greater confidence in. So sometimes this kind of detailed research does take time. Now, the report, as we've said previously, the report answers some things. It says that there's, not the statistical evidence that discharges from hospital were the biggest factor in care home outbreaks, but there are still other questions that it doesn't answer because it wasn't asked to answer. This is an ongoing process of understanding and learning to make sure we protect people as much as we can. On Christmas, I want to be standing here closer to Christmas saying, well, firstly, I don't think I'll be standing here in the run-up to Christmas saying it's 100% normal. I don't think there'll be many leaders, if any, anywhere in the world will be saying that to their populations. Even if you look at a country like New Zealand, which has, suppressed very low, its borders are pretty much sealed. So, even there will be things that are not normal in terms of ability to travel in and out of the country. So no leader will be standing here in the midst of a global pandemic and saying it's 100% normal. I hope with everything I've got that I'll be standing here saying it's more normal than it is right now, and that there will be some greater ability to see family and friends and loved ones. I want that as a individual. I want that. I want to be able to see my family at Christmas just like everybody else wants to be able to see family at Christmas. But we have to make these judgments in terms of the detail of them closer to the time and based on as much overall information and evidence and data about risk as we can. And there will be an element of this where people have to make their own judgments too, and I don't deny that. But what I don't want to be doing, and I'm not being melodramatic here, the bishop who, for sentiment that I absolutely understand and actually share, who said at the weekend, let's have a Christmas armistice. The virus is not an enemy of that nature. I can't, unfortunately, go out here and get the virus on the phone around the table and say, can we have a ceasefire for Christmas? It's a virus. It doesn't work that way. I wish it did. So what I don't want to be doing is standing here, as I will be if we're still in this pandemic, because I'm not going to shy away from that, standing here in January or February talking about did we allow more deaths to happen because we didn't put enough safeguards into the advice we gave people for Christmas. And these are really difficult things, and the last 7 months have been so difficult for everybody. I think the next few months, because of what they involve, are going to be more difficult than anything that's gone before now. And we just have to try and steer our way through that with as much normality as we can muster, but recognising that we are all going to be finding it difficult. And the government will try to give as much advice and support as possible and try to enable people to do as much as they want to do at Christmas as safely as possible. But my last point is this. We're going to have more chance of being able to do more of that if we all dig in and stick with it right now. And that's the one thing we do know beyond doubt. If we all work to get this virus back to lower levels right now, the opportunity for greater normality at Christmas is more than it will otherwise be. That concludes the questions. We've been dealing with some really important issues today, so my apologies for particularly to Gregor, who's had to stand through many of them to my lengthy answers. But these are really important issues. They're important for those who've lost loved ones, but they're also important because we're not out of this pandemic yet, for us to make sure that we're learning lessons, and that's what we really tried to do. Thank you for joining us. Tomorrow I will join you not from here but from the Scottish Parliament again at I think 12:20, where I'll give an update on the allocation of different levels to different parts of the country before taking questions in the weekly session of First Minister's Questions. And on Friday, it is likely to be the Deputy First Minister who is leading the briefing here, and he will obviously answer questions at that point, and I will be back here, all being well, on Monday at 12:15. In the meantime, please stick to all of the rules and the guidance. It's not easy, but it is for the sake of all of us and for our National Health Service. So thank you very much, and I will see you tomorrow, albeit from the Scottish Parliament.